today's Facebook Live Town Hall. Today, we will be diving into a really important subject. We are working together to mask up for Orange County. And I'm very pleased to be joined today by a couple of wonderful guests. Dr. Neumer is an epidemiologist from UCI. Jenna Jensen is CHOC's Chief Government Relations Officer. Libby is from MakeMasks.org. And we have Leah Ursulou, who is a community mask maker. Thank you all for joining us. Now, before we get started, we'd just love to give you a quick opportunity to introduce yourselves to the folks at home. Dr. Neumer, we'll start with you.
Thank you. Thank you for having me, Assemblywoman, and thank you for your leadership during this time. I'm here as a nonpartisan scientific expert from UC Irvine. I am an associate professor of public health, and I'm a medical demographer and epidemiologist, and I've been studying the coronavirus epidemic as it's been unfolding and since its very early days.
Well, thank you for being here. You've been a tremendous resource for UCI, for our community, and for my office. So we are so grateful for your expertise and your insight. Jenna Jensen, thank you for being here.
My pleasure. Thank you for inviting me. I have been at CHOC for 27 years. I handle government affairs for the hospital, which in large part involves advocating for sustainable healthcare funding for children who get their care through the Medicaid program, which in California is the Medi-Cal program. So I spend a lot of time focusing on making sure that children whose parents can't afford insurance get good care, and we provide that care at CHOC. And during COVID, I have been a member of our command center, which has been a huge honor to work alongside our clinicians. And we've been operational in the command center since March 16th, and I serve as the liaison officer. So I have information I can share from my colleagues down there.
Wonderful. Well, and CHOC is such an incredible resource for our community. And I know that you all have gone to just truly extraordinary steps to prepare for COVID-19 and to meet this moment. So thank you for that. And Libby, thank you for joining us.
Yeah, thank you for inviting me. Obviously, masks are very important to me. I founded Make Masks actually in March, which, as we know in COVID time, was about 10 years ago. So mostly I knew that I could make masks, but I wanted to be absolutely certain that the masks found their way to people who needed them, instead of just having a pile of masks in my home that never did any good. So we focused on back end and making sure that we could make good masks that filled orders for facilities that absolutely needed them.
Well, and I know as we go through our conversation today, we'll be hearing more about you and the work that you and your organization have done, but it's just been tremendous. You've been such an incredible partner for my office, and you have been, I think, a real lifeline for so many organizations and so many people across the county. So we are thrilled to have you here today and to learn more about you and to tell folks how they might be able to get involved as well. And Leah Ursulou, thank you for joining us as well.
Sure. I'm just excited to be here with so many inspirational folks. My mask making journey was my mother kind of kicked it off. If you see this large quilt behind me, my mother is a fantastic sewer, and she's also a nurse back east at Dartmouth Hospital. So when the whole COVID situation was beginning, I was feeling particularly vulnerable because I'm asthmatic, and I wanted to, as much as I wanted to work at the food banks and the food drives and be out there like I normally would, I've just been stuck at home. And so my mom sort of suggested, you know what, take out your sewing machine and show your daughter, my daughter's 9, how to use it and, get to business. And so I was so thankful for Make Masks because they had the templates on their website, and it just made it really meaningful and a clear path for how to help. So it was really great.
I think for me, one of the most incredible things about this moment of real crisis has been the way that so many people have stepped in and stepped up to meet this challenge and to do everything that they can to help their community and to help their neighbors. And I know that sometimes we turn on the news or we look at Facebook, and it's easy to feel overwhelmed and discouraged. And it is it's people like you, Leah, and you, Libby, that honestly give me that little boost of inspiration every single day. And so we're so grateful for both of you for being here, sharing your story, and for everything that you're doing for our community. So what we'll do, we've got a handful of questions that folks have sent in. So we'll make our way through those, and then as people ask questions through the Facebook Live, I'll weave those into our conversation as well. So the first question is, what are the rules right now for wearing masks in California? And this pandemic is evolving really, really rapidly. Our knowledge and our understanding of the pandemic is evolving very rapidly, and seems like things are changing and pretty fluid. So the rules right now for wearing masks in California, wearing a mask is required statewide anytime that physical distancing cannot be observed or is not possible. So, when should you wear a mask? In any indoor public space, when you're waiting in a line, when you're getting healthcare, when you're on public transit, if you're at work, if you're not in your own private office, if you're near others or moving through a common space. And importantly, we also need people to wear masks outside, again, when 6 feet of physical distancing is not practical. So that's the what of the rules right now, the rules of the road in California. Dr. Neumer, can you help us understand the why? So why are we requiring masks statewide?
Thank you. Yes, I think it's important to talk about why, because people will understand better and be more enthusiastic about wearing masks if they understand why, as opposed to just being told, with a wagging finger that you have to mask.
Mm-hmm.
So masks form a barrier between our respiratory system and the outside world. COVID-19 is spread by respiratory droplets. These are small droplets of water that are expelled when we speak, potentially when we even just breathe, and certainly when we cough and sneeze. And these droplets are small, but they contain thousands of viral particles per droplet. And they eventually sink to Earth or by gravity, but they can waft in the air for a little bit before they fall, and they can be inhaled by someone else. And so by putting a mask in front of our nose and mouth, those droplets, stick to the fibrous material of the mask instead of going into our nose and throat. And so their transmission gets interrupted. And even though the virus itself is very small, 120 nanometers, it's not the naked viral particles that we inhale. We inhale very small droplets of water in which there are hundreds or thousands of viral particles. And so by interrupting those drops, which are much larger and which a cloth mask can interrupt, we can block transmission from person to person.
And kind of a follow-up question. So what evidence is there to support masks? Have there been scientific studies that again, to your point, can help people understand why this is so important?
So exactly. One other thing that's important to note is that the infectious dose of coronavirus is about 1,000 viral particles. So if you get exposed to fewer than 1,000, you actually don't get infected. So a single viral particle doesn't make you sick. So the infectious dose is anywhere from 1,000 to 1,000,000 viral particles. And the more you get, the worse the disease can be. That's known as the dose-response relationship. And so if we're walking around unmasked and we inhale, two droplets of someone else's sneeze, we could get infected with 10,000 viral particles right there, because the virus is so small. But if we are wearing a mask, it may not block all of the virus, but it may knock it down to 200 particles that actually enter our body. And that's below the infectious dose. So the masks don't have to be perfect. They just have to be good enough to work. And the dose-response relationship is a very well-studied phenomenon in infectious disease. And the fact that the virus that the masks block these droplets is also well known, because we can study how droplets adhere to the fibrous material. Now, some people said, well, how can we prove that it blocks every single viral particle? And the answer is that's very difficult to prove, but it doesn't have to block every single viral particle. It just has to reduce the number of them, which even if we get infected, could lead to a milder infection. And from everything we know about this disease, that a milder infection is what, you know, we should all wish for if heaven forbid we become infected, because the mild infections are quite mild and the severe infections are quite severe. The other thing is, we know that countries that mask more have been doing much better. And, you know, that is observation of millions of person years of exposure to the virus. And we know that places where people are masking, and where masking hasn't become such a hot topic, where people are just happy to do it, those places have had much better outcomes so far in the pandemic. And you know, I think we all would like to be more like those places.
I think that is such a good point, because I think it's you know, it can be easy for people to get kind of hung up in, you know, some of the minutia, but when you pull back, the bottom line is that the countries where universal masking is the norm are doing much better right now. They've got lower rates of infection, they've got lower rates of hospitalization, and they've got lower rates of death, and that is incredibly compelling evidence. So next question. I read that wearing a mask could actually be harmful to me. Is that true? And Jenna, let me start with you on that. Oh, you're on mute.
There we go. You know, I've been watching a lot of town halls, including you know, speakers at our Board of Supervisors and at the Orange County Board of Education meetings, and in particular, parents speaking about you know, potential harm from wearing masks. And you know, I can tell you, I listen to people like Dr. Neumer all day, so I'm gonna sort of relate to what I'm hearing from our clinicians in our command center, and what we're all reading is that we haven't seen any evidence to suggest that wearing masks is harmful for healthy people. Now, if people have breathing problems, and children under the age of 2 should not wear masks, but we haven't seen really convincing evidence that wearing masks is harmful to people. And I think we're all seeing the effects of not wearing masks in our community. So I would say that we haven't seen evidence to suggest that. And I'll defer to Dr. Neumer as well as a clinician here, but this is what I understand.
Dr. Neumer, anything you'd add?
Well, I mean, the argument is sort of like, well, if you wear your seatbelt, you're gonna drive more recklessly, and so you shouldn't wear your seatbelt. But you know, we know that seatbelts save lives, and masks save lives, and you know, enough oxygen can get through a mask, you know, for us to breathe. We actually don't use, you know, most of the oxygen that we inhale every time we breathe just gets exhaled again. There's plenty of oxygen in the atmosphere to keep our blood red. And as far as masks being dangerous because they concentrate the virus, this is something you hear, that when you touch a mask at the end of the day to take it off, you all of a sudden contaminate yourself. You know, if the mask has been protecting you from millions of viral particles all day long, aren't those millions of viral particles now stuck to your mask and you're just concentrating the exposure? And the answer is no, because they desiccate. And the other thing is, you can take off your mask, put it down, and wash your hands, and you're good to go. You know, and would you rather that those particles just have been entering your respiratory tract the whole time? Of course not. So it doesn't work that way. I mean, those stories may make sense at some intuitive level, but I'm here to say that the science just doesn't work that way. And so, you know, I wear a mask every time I leave my house, and so I practice what I preach.
And we started to get at some of the misconceptions and some of the information that is circulating around mask wearing. I'd actually like just get everyone's kind of perspective on this regarding, I guess, two things. Number one, what are kind of the most common misconceptions and misinformation that you've seen around masks, and how do we cut through this? How do we get a clear and consistent message out to our community? Libby, let me start with you.
Oh, sure.
What are some of the misconceptions?
Sure. One of them is that it messes with the proprioception, that people have a hard time knowing how to walk or where to put their feet, or they feel dizzy. Okay. And they ascribe that to, as the doctor was saying, like lack of oxygen and, not respirating well. And one thing that I've said to people who are uncomfortable in masks or feel strange in them is it's like a new pair of shoes. You wear it around the house a little bit and break it in and get used to the feel before you go on a long hike, because that's just going to do damage to your feet before you know how well they fit. And just get used to wearing them. And that really alleviates a lot of the self-consciousness. And I really feel like that's a lot of what comes in almost psychosomatically to how you feel wearing the mask. Just making it so that you don't have to wear it to keep yourself safe necessarily. Like, don't think about it as a barrier to the world. Think about it as you are interested in keeping others safe and helping keep our entire community running and safer. And I think people have that kind of empathy that they can tap into, and that makes a lot of sense to them.
Absolutely. I don't wear a mask to protect myself. I wear a mask to protect you, and you wear a mask to protect me.
To protect me.
And
yes.
If we all act with a sense of kind of common decency and common good, as in most things, that will go a long way to enable us to successfully meet this pandemic. Leah, other misconceptions, misinformation that you've heard from folks in your community, and your thoughts on how do we dispel some of that? Oh, you're on mute.
Yeah, no, it's interesting because, I'm not a clinician or anything, but when I'm out and about hearing from different people, they are mentioning, how hard it is to breathe. And, as an asthmatic, I'm like, let me tell you how breathing can be hard. But I think it's that sense that almost everyone's anxious these days. There's a global pandemic. I feel like some people have this sort of unmitigated anxiety, and the mask may make them feel claustrophobic. It's very valid. Like, to what Libby's point was, I think is very important. It's sort of a psychosomatic response. I feel like people feel like they're not breathing well in it, but if they took their pulse ox, I think they would probably find that they're fine, but they're just so uncomfortable, and they don't have the tools to figure out how to breathe calmly. And, I would just suggest breathing exercises for just a lot of folks, because it really just helps you realize, what? Yeah, it feels weird and constricting, but it's really not. Like, I'm running for school board right now. So before I came on this call, I was out dropping off flyers at houses with my mask on, but I was trying to go really quick, especially when Robbie asked me to join this this morning. And I was walking very briskly with my mask. It's not comfortable, but it's fine. And I'm getting oxygen, but I think it's that almost panicky response that people are having and not wanting to recognize and work with, because it is what it is. But like Libby said, the shoes, you get used to it, but you have to be ready to get used to it.
Assemblymember, can I say one thing on this?
Yeah, please.
This is a pet peeve of mine. So if I'm going to say anything on this, I'm going to say this one thing, is that I keep hearing that children can't wear masks, that children can't be expected to wear masks, that young children shouldn't be expected to wear masks, that it's impossible for children to wear masks in school. And I will just say, I've been at Chalk for 27 years, and I have watched children do some incredibly, incredibly difficult things, much, much, much more difficult than wearing masks. And we here at Chalk have tremendous faith in children's ability to learn new habits, especially healthy new habits. And we have a blog post about helping children who are afraid to wear masks. And the link is shared in the group chat here. So you can go to our blog and read some tips from our psychologists about how to encourage children. But we know that even children as young as 3 and 4 can learn how to wear a mask. So I would just really encourage everybody to take a look at that blog post. And I just get so frustrated every time I hear what children can't do, because we know how much children can do. So I just wanted to get that off my chest.
Yeah, that's a great point. You each and every day work with children who just rise to enormous challenges with incredible reserves and incredible strength. One suggestion from a mom friend of mine with somewhat younger kids is, it's like superheroes wear masks, right? Yep. Superheroes wear masks. So, you can be a superhero. You can even, put a picture of your kid's favorite superhero on it, and you stick your superhero mask on before you go out. And especially young kids, they are up for that kind of, of role playing and game playing and engagement. And so making it fun rather than something that is scary. Actually, so Dr. Neumer, I have a question for you. So for folks that do say, oh, I can't breathe, I don't like it, et cetera, are the plastic face shields a reasonable alternative? Do they provide the same level of protection?
In my opinion, they're not as good, but
Okay.
they're better than nothing. I would like to just say for a sec, masks do work better when we all wear them, because you get this synergy effect that everyone's masking, and masks also they prevent exhalation of COVID particles to the atmosphere from people who are infected. But I do want us to all feel like we have skin in the game. They also do protect ourselves. I mean because the mask, the droplets that we might inhale, can stick to the fibrous material of the mask, and they do help protect us as well. So everyone watching this at home, you have skin in the game. You are protecting the community by wearing a mask, but you're also protecting yourself. So I think when we don't want to emphasize too much that we're just protecting each other, because then people might have a feeling, well, I don't really believe this. Well, do it for yourself if it's not persuasive enough to do it for others. I mean, I think doing it for others in and of itself is enough justification. The facial shields are better than nothing, but I mean, they're really used principally by clinicians in addition to masks, because through the tear ducts, the eyes are a sort of a circuitous entry point to the respiratory system. So if you're a clinician performing a procedure at close proximity to a COVID patient, you don't want any droplets getting in your eyes, because then through the tear ducts, those viruses can enter your respiratory system. So that's the principal role of the face mask. I mean, the airflow under the face mask, face shield, when it's not backstopped by a mask, is there. So it's not as good as a mask. And if you're going to wear only one, I would say wear a mask. But face shields are better than nothing. It does force the airflow sort of down and around as opposed to straight in. So it's better than nothing. But I would rather see a mask than a face shield if I had only one choice. And these masks don't need to be masks for use by non-clinicians don't need to be super tight fitting, super constrictive. I mean, a cloth mask that just fits over the nose and mouth, does a good job. So if people are getting claustrophobia from using a mask that's too tight or something, I'd rather see a mask that's a little bit looser than just a face shield.
Yes, and thank you for that, and thank you for clarifying that. To use your words, we all have skin. We all have skin in the game. So it's about protecting ourselves, our families, and our neighbors and our community. So next question. I'm worried that a lot of people I see in my city are not wearing masks. what's being done to enforce these rules. So I'd say both at a local level and statewide, we have been really focused on education rather than enforcement. But while we want to be able to focus on that, and we believe that if enforcement is required, then it is best done at a local level. The state is prepared to intervene if local law enforcement agencies or local governments are not prepared to enforce masking policies, because it is a critical public health priority. And the state has tried, so the state of California has tried to incentivize some of our local partners by making $5 billion of funding available to help promote universal masking and providing additional funds to cities, to counties that are enforcing these policies. And I guess when people ask me about enforcement, if my response has always been that, you know, when we go to the bathroom, we wash our hands, and it's not because we think that we're going to get arrested. It's because we have been taught that stops the spread of germs. It's the right thing to do. And similarly, when I leave my house, I put on a mask. It's not because I think I'm going to get arrested. It's because it stops the spread of germs, and it is the right thing to do. And I think that the more that we can kind of acknowledge that universal truth and sort of see it as, oh, it's like washing your hands, or Dr. Norman, to your point, it's like wearing a seatbelt. It's things that we do to keep ourselves safe. I don't know, you know, any other thoughts on that, and you know, any other reflections on the question of enforcement, and what would anyone like to see us be doing more, less? What are your thoughts, kind of from the community perspective?
I mean, as a public health professional, I'm always very wary of associating public health with some sort of penalty or citation. You know, so I would rather see people get educated about the benefits to themselves and to their household members and to everyone for wearing a mask, as opposed to, you know, here's your parking ticket, so to say, for not masking. So I would see, you know, strict enforcement as kind of a last resort. You know, I would love to see, you know, community members reminding one another politely. I mean, about mask wearing. I think, you know, a police officer or a sheriff's deputy could remind our friends and neighbors, as opposed to giving a citation. That would be my vision of where we could go.
And Leah, what would you add to that?
I would say something that I've heard around here locally, and I'm in Costa Mesa, is just to make sure that when you are going to do enforcement, to make sure that there's a really clear education of that enforcement, because I've seen or heard online many people saying, oh, I'm going to get a ticket because I'm out walking my dog. I'm out running around the block. And highly unlikely, right? But I think communicating that out very clearly to folks that that's not what's going to happen. You're allowed to exercise.
Right. And that is, yes, that is certainly, you know, not the goal or the desire of anyone. And I think that what we've seen is at a state level, any of the enforcement actions that have been taken have been around, you know, a handful of businesses, and actually none locally, but businesses who have kind of gone out of their way to flout the mask ordinance, to sort of make light of it, to, you know, have grand reopening without masking kind of parties. And that is the sort of thing where I think intervention is warranted. But yes, clearly nobody wants to be running around giving tickets to people out walking their dogs. We can all agree on that. So, and you started to get to this a little bit, but what kind of mask am I supposed to wear? So, you know, normal person going about my you know, day, running errands. What kind of mask do I need to wear? Jenna, let me start with you on that.
So we started requiring masks on our campus back, and I'm going to say late March. We started asking our visitors and family members to wear masks, and we were able to receive some home sewn masks from your office, Assembly Member, and probably from these great sewers that are on the
Yes, it was.
So
It was
I want to
from these
thank you.
folks.
I
Yeah.
really want to thank you personally for what you're doing, because we appreciated that so much. So those are cloth masks that we're asking our parents and patients to wear. So, I would say cloth masks are very effective. We really need to save, these masks, these surgical masks and N95s for healthcare workers who are coming into work at the hospital every day and working in clinics and things. I think that we recommend cloth masks for our kids and their families, and I would say they work very well. That's our position at Chalk, is that we are giving cloth masks to our patients and their family members. And, I ask my family members to make sure they're wearing cloth masks. You can wash them, you can reuse them, they're sustainable. So I think they work great.
And Dr. Neumer, anything you would add to that?
No, I think that pretty much encapsulates it. The professional level masks should be can be used by the clinicians, and we in the public we just need some sort of facial covering, and I think that sums it up.
Mm-hmm. And we do have a question around just the supply of masks and personal protective equipment. So, over the last several months, there's been headlines, front page news, both across the state of California and nationally, about just this critical shortage of personal protective equipment. So, does California have enough masks right now? So just, from the state's perspective, we went through a period where there was an absolutely catastrophic shortfall in our supplies of surgical masks, N95 masks, and personal protective equipment, insufficient supply to serve our medical system. And that has been one of the primary priorities for the state of California. For the last 4 months, a really Herculean effort has been underway to build surge capacity, with hospital beds, with personnel, and also with sourcing personal protective equipment. And the governor often points to kind of our supply of N95 masks as a barometer of how we're doing there. And since the start of the pandemic, we have now distributed 80 million N95 masks across the state, and we currently have 46 million in inventory. So we have been preparing, we are prepared, but to reiterate, I think, Jenna, your point, we need to ensure that these surgical masks, these N95 masks, are that we have a supply of them for our medical professionals and frontline workers. The community, we can use cloth masks. And so, Jenna, that's kind of my, I guess, 1,000-foot perspective from the state. As someone on the ground in our local hospital, what is your sense of our supply of masks and personal protective equipment locally?
So I know that we just received some masks yesterday from the county's cache, and they get those from the state, and yep. So that's wonderful. We just got a supply yesterday of N95s and gowns and some other PPE. So I will say that the county has been a great partner in fulfilling our requests as long as they have the supply. The issue is that we don't have exactly the same N95s that our staff is used to wearing. So they're getting used to, we do fit testing and fit checking on N95s to make sure that the mask fits the staff member just right. And so the masks that are the biggest favorite among our staff, we can't get anymore, but we got replacement, sort of alternative supply yesterday. So those are going to work for us, and we're really grateful to have those. So I will say the supply chain is seeming to work a lot better than it has been. We have had points during this where we were desperately in need of hand sanitizer, disinfecting wipes, all kinds of kind of disinfecting supplies. So those are still challenging. We still are getting replacements for some of the supplies our staff is used to, and you might think, well, it's soap, why does it matter? But when you have, 4,500 associates in an organization who are using a certain type of soap that seems to be the most effective and prevents skin irritation the best, when you switch it out, you're going to have issues, right? So we've been continuing to work through those issues. So I'm going to say the supply chain issues aren't completely solved yet, but we have N95s right now for our staff. That being said, we're using a lot more N95s because whereas the early months of this, we had no kids in the hospital with COVID, today we have 15 kids in the hospital with COVID. So we're burning through those N95s a lot quicker than we were. So we're still paying really close attention to the supply of N95s and other PPE because we're using them a lot more because the rates are going up.
And so what can the community do to help hospitals like Chalk preserve and maintain sufficient protective equipment for our frontline workers?
Well, I think back to what we were just discussing is that, if you're not working in a clinical setting, use a cloth mask when you're out going about your business in the world, and, try to preserve the supplies of PPE for the medical workers and the clinicians who need those things. It's probably the most important thing. But Chalk also puts an email out to community leaders about once a week, letting people know which things that are in short supply. It's called our top 5 list. So we list the things we need. Sometimes toilet paper has been on there. Soap has definitely been on there, disinfecting wipes, masks, all kinds of things. So we put that email out once a week to just find out if there are sources of supply that we haven't already found out about where we can get the things that we need.
So I guess for the general public, it's, don't use medical supplies if you don't need them. And I guess the other is, don't hoard. We went through that, very weird moment where, all of a sudden you couldn't buy any toilet paper, which was just like completely irrational. So don't hoard, don't use supplies that, that you do not need, which is, I think, it's a good transition to the work, Libby and Leah, that you've been doing in our community. So Libby, let me start with you, and then Leah, I'd love to hear from you as well. What inspired you and your organization to start making masks? You said you started back in March.
Yes. Well, I started after seeing a news report on a hospital that called for area sewists to start making cloth masks because they had a similar situation. They had decided that any mask was better than no protection. They couldn't get N95. And so they asked if you knew, here's instructions. And if you know how to sew, please make us these. They didn't have anything else. And I knew from being a quilter as a hobbyist that I could certainly tackle making a mask, but I had to make sure that the hospital that first called for them needed them still by the time I finished them. And then if they didn't, I had to know that they would go to good use, which is why Make Masks even happened in the first place.
And so you have now become this organization that connects community mask makers and
That's right.
Hospitals and others that have a need. And
we get orders from facilities, and then we make sure to match the makers who have come to us with finished masks, and then we get them. So it's not, we don't just hit people up and say, hey, we have masks, can we send you them? Facilities in urgent need have talked to us, and we fulfill those. So that was the way that we handled it.
That's terrific. And Leah, how did you get connected and start making masks? You explained your mother was kind of an inspiration. How did you find Make Masks as you were trying to figure out what to do?
No, so my mother was telling me I should make masks, and I thought my sewing machine is dusty in the garage. I'm going to let it sit there. And then it was actually staff in your office gave me the idea. They said that they were working with Make Masks, and that they had some extra material and the extra elastics, and they could drop it off, and all I had to do was make the masks, and then we'd pick them up. So I thought this could not be more seamless and simple. and a great excuse to teach my daughter some life skills and how to sew. So it just was a really natural, perfect timing, perfect fit. And I'm really glad that your office was connected to Make Masks and just made it such a seamless process. And thank you, Libby. This is such a phenomenal organization. And it really, you just made it so clear and easy for all of us that want to give back to do it. So I really just appreciate you. Thank you.
Thanks. Thank you for making.
And Libby, how many community sewers do you have, and how many masks have you all been able to make?
So I would say that we topped out at about 1,500 people.
Wow.
Some people are super sewers, and they just one of our sewists today, she actually got a Points of Light award for making. She's over 8,000 masks on her own. And then there are some people, yeah, that's a lot. And then there are some people who made, you know, with extra material they had lying around 15 and said, that's what I can do. But, you know, 8,000 or 15, all of them go to a good purpose. And then combined, we made over 80,000 masks and sent them to over 500 facilities.
That is incredible. And who have been the main recipients for the masks?
So we started focusing on hospitals and clinics, frontline workers who talk to us. And then another thing that I worked on the side was contacting places that had N95, and they agreed to take our masks, and then they took their N95 and moved them forward to hospitals and such without. So like the San Diego Humane Society, we worked with them a lot. They got a lot of their N95 forward when they got our cloth masks. Some construction companies, there was a streetcar company in Oklahoma City that we sent masks to, incarcerated people, group homes, nursing homes, a lot of supermarkets that didn't have a choice but to be open early, homeless people.
And so if folks at home are thinking, all right, you know, this is something maybe I could do. I could dust off my sewing machine and give my daughter some lessons. Leah, how should people get started?
No, honestly, Libby made it so easy. They have the pattern there on their website. I downloaded the pattern. I followed the measurements. I had the fabric, the yards of fabric, and I just started, you know, you just figure out how much fabric you're working with and measure it out and just start, you know, being systematic. What I did was, and I know I have a girlfriend of mine that she made far many more than I did, and she made her own pattern. But what worked for me was doing all the ironing first, ironing all the pleats first. So I just had a pile of stuff that was cut and ironed and in perfect position. And then the next day I could take out the machine and do the sewing part. So it's really just figure out the pattern for you that works best and the method to your madness, and just go for it and figure out, you know, how much time are you able to dedicate to it, and just sort of, you know, plan it out. Do you want to be doing it, you know, each day? Do you have time each weekend? And just figure out what works for you and your family. And I think the bigger benefit, because I'm on the very low end of the folks that that Libby's talking about, I probably made under 50, but I was able to get my other friends that were making masks already on their own and tell them about what your office was doing, Assemblywoman. And so they also dropped me some masks to bring over to your team. So it was just great, you know, community building, and people were at home and they have this skill, and it's just really a good way to give back.
That's terrific. So Libby, I'll start with you. Can you remind our community and viewers the proper way to wear a mask?
Oh, sure. The most important is that you have to have your nose covered, and you need it to go below your chin, because you want it to cover everywhere that you have your main respiratory system active, right? So you don't want your nose sticking out, right? I have a mask here. So you don't want to wear it so that your nose is out like this, because at that point you're not doing the good that the mask is supposed to do. And you also don't want to wear it around your chin.
Right. I always chuckle when I see people with it around their chin.
Yeah, there's quite a lot of good memes online that I have been introduced to of masks. And then you just wanted to make sure that it fits, like Dr. Norris said, it doesn't have to be constrictive. It doesn't have to, it's actually better if it's not super tight. And you just want to make sure that you don't get tons of airflow forward. The more that you can redirect your airflow and the flow in, the better. So That's my recommendation. And
All right.
if you want, you can, you can put some tape or something to keep it closer to the nose, but for everyday use outside for an individual, that's not as vital.
Got it. Yeah. And Dr. Neumer, how often should I wash my mask?
That's an excellent question. One thing that people have to understand is the virus doesn't persist very long environmentally in terms of, so one thing I do is I cycle them. So I'll wear a mask and then I'll put it in a corner of a countertop where I won't touch it. And I'll leave it there for 48 hours. And the virus doesn't live for that long unless it's in an organism where it can reproduce. So, I mean, one thing is if the mask you're using isn't amenable to washing, then you can cycle. You can alternate between masks and let them sit. And then if you can put them in the sunshine, that's even better, because the ultraviolet light of the sun will help with that. But otherwise, if you have several masks, they can be washed every day if you have enough to do that. And if the masks that you have, I mean, maybe some of the other guests can comment on how durable their masks are in a cold water wash. But when the pandemic began, we were very worried about surfaces, and it's becoming apparent that surfaces are not the major route of transmission.
Okay.
And one of the reasons is that the virus just doesn't live very long when these droplets desiccate. So that's good news. That's one bit of good news that we've had. So just keep that in mind when we think about the mask.
Got it. Okay. So actually you made me feel a little bit better, because I know I've read online you're supposed to wash it after every use, and then I ended up not doing that. So you're saying that, yeah, that's a good practice, but you can also kind of cycle through, and if you let something sit for about 48 hours, then you can kind of bring it back into your rotation. And do we need to do anything special when we're storing it? You said you could just sit it on a counter.
I mean, sunshine would be better if you have a sunny spot. The ultraviolet will help with that. I mean, the virus is just not very persistent environmentally. It doesn't live outside of water droplets for very long. So
okay.
It's really being spread in the community from person to person via respiratory droplets. And so it's not an environmental contamination issue. It's a proximity to other people issue.
Okay. Got it. And like you said, we are learning so much about this virus, seems like each and every day. So I have an N95 mask at home. Can I reuse that? So recognizing that we don't want people to buy a N95 mask if you've already got one. Jenna, can we reuse N95 masks? Can people sterilize them at home and reuse them?
So I know we're looking at sterilizing protocols at Chalk, but it's using an ultraviolet box, which I'm guessing most people don't have at home. Right. So, I guess the question would be, how long are you going to plan on reusing that N95 mask? And I would again defer to Dr. Neumer as an epidemiologist and thinking about, we, in the clinical setting, we try not to reuse those for very long. If you're using it, kind of intermittently, for personal use outside of a clinical setting, I don't know, Dr. Neumer, how long do you think an N95 is usable?
Well, people have also studied heat sterilization. I mean, the issue is partly the N95s are designed for clinical use, and with clinical use, the likelihood of exposure is greater, and so. If we're just going to the grocery store, it's definitely different than a clinician who's seeing patients all day long, including some patients who have an extremely high likelihood of actually being infected, as opposed to the person next to you at the grocery store where who knows, probably not. I mean that. So as long as the mask doesn't have any cracks or or whatnot, I think it can be reused if it's been cycled. There's also 60 degrees Celsius in the oven for 60 minutes. I think is what I've read is what people are doing at home, and so that would be relatively low heat by baking standards, of course, and so I don't know that anyone really knows for sure. I mean, the issue is the integrity of the material. So if there's a crack in it, or if the elastic no longer fits well, then I would say to use it again. I mean, one thing I have not to stop using it again. In other words, this pandemic is going to have duration. I mean, it's been with us since February. We're now creeping up on August. And if we all mask, it's going to attenuate a lot. And the more we mask, the less critical it will be, because it will go away. But we do have to steel ourselves for the long haul. It's going to be through, unless and until a vaccine comes, it's going to be certainly through the end of spring 2021 before we can talk about going back completely to normal. And so if you have a mask that looks good, I would say put it in the sunshine, put it in the oven for an hour at low temperature, cycle it, or because you may need that mask in February, March of 2021. And if you have 10 masks at home, don't just use it and throw it away and then in September start looking for more masks, because we have to steel ourselves for the long haul.
Yep. So a couple more questions. Are my kids going to have to wear a mask at school? So yes, for the state of California, masks will be required for all staff members and required for students who are in 3rd grade and above. And then masks or face coverings are recommended for students who are in 2nd grade or below. And we talked a little bit about, I shared, kind of a couple of my thoughts on how do we get kids to wear masks. Jenna, you shared some. I'd love, Leah and Libby, do you have any tips for folks at home? How do we get our kids to wear masks and feel comfortable doing it?
I think normalizing it goes a really long way, like not treating it like anything else than you do to get ready for your day. You get your lunch, you get your backpack together, you put your coat on, and then the mask, right? It's just part of the routine. And the more we habituate to things, the easier it is that we simply do them. That's what habit building is. And it goes a long way for our psychology, even for, as Jen was saying, rightly, children can learn things and they're willing to do them, even if we think of them as having a lot of static involved. So I would just say making it as normal as possible. Not talk about getting back to normal or life without masks, but rather dealing with today we wear masks. And we're going to continue to wear masks until we stop.
Yep. And Leah.
Yeah, similar to what Libby said. And I mean, my daughter, fortunately, she's 9 going on 19, so she loves fashion. And so for her, it's been an easy sell to just make very cute masks.
Got it. So mask is fashion statement.
Cute Perfect. One, and yep. that keeps it on, so we're good.
One of the things that our psychologist also shared is letting kids have some agency, so letting them pick. That maybe they have a few masks and they get to pick which one they want to wear on a given day, which gives them a little bit more control. And then the other idea I saw was to not make it a choice of, do you want to put your mask on? It's which mask are you going to put on, so that they don't have the choice of whether to do it or not. Don't give them a false choice, but let them have a choice of which one they want to wear.
Got it. And you mentioned, and I know we've shared that in the live stream, you mentioned a blog post on Chalk that goes into some more tips for parents at home. So with that, we're at the end of our time together. Before we go, I'd just love to give everyone kind of an opportunity for any parting thoughts or closing comments for the folks at home? Libby, we'll start with you.
No, just I think it's right to consider this as a long haul and not to let yourself get fatigued by it, but just to, as I said, even with the kids, one thing that I've said to myself and then also the mask making group is that try not to put it in terms of get back to normal, put it in terms of this is the way we have to live now. And it's okay, because this is what's going to keep ourselves and everyone else safe. And what happens next is next, but normal is now. And get good sleep and hydrate.
Yeah.
And I'm really glad to have this conversation again and again, because it's good to update our understandings. It's good to update our data, and it's good to remind people to look out for each other, but also do what's needed that we look out for each other. So thank you.
Thank you so much for being here and for everything you're doing. Leah.
Yeah, along the lines of what other folks have said, that it does appear to be a long haul. So, buckle up, get comfortable, and find some fabrics that work for you. Some people I've seen are wearing the gator ones, the ones that go down to your neck. Find the make and model that works best for you, because they're just going to be around for a while. So find a way to be comfortable.
And Andrew.
Masks are the number one weapon in our arsenal against coronavirus. And that is, really the best weapon we have right now until we have a safe, effective, available, and affordable vaccine. Masks are really the only arrow in the quiver for a public health response. The number one arrow is masks. Everyone should mask. The prevalence will go down and we can all, breathe easier. We're not going to get to zero in 3 weeks if we mask, but we will get to a better place, and we will stay at a better place if we mask. And it's really the best thing we can do, and it's what I'm doing every time I leave the house.
Thank you. And Jenna.
I would just say probably one of the most difficult thing we're struggling through right now is whether or not schools will be able to reopen eventually. And we know the governor, issued his order last week about schools starting back virtually because of the infection rates really escalating across the state. I think that Chalk really, really wants schools to be able to reopen as soon as they can do that safely, because we know that's what's best for children and their families and for our communities. We got to wear masks in order to get there. There's just no way we're gonna get to the place that we want to be for schools to be able to reopen safely if we're not getting these infection rates down. So I just echo what Dr. Neumer said about masks being the number one tool. We just don't have that many tools. So we got to use the ones that we have.
Well, thank you for that. And thank you all of you for joining us today and for sharing your perspective. As our other panelists have said, masking is the number one thing that each and every one of us can do in order to fight COVID-19. This is a long road, and we've got a tough fight ahead of us. And the only way that we are going to be able to reopen our schools, to fully reopen our businesses, to get our economy moving is by getting this virus under control. And the only way that we're going to be able to do that is if we all mask up. So thank you for joining us today. Look forward to seeing you next week. Stay safe and mask up, Orange County.